Continuing our talks on anticipatory guidance, the second thing we look at is fluoride adequacy. Are we getting enough fluoride? And there's tons of research out there that shows that fluoride is a very, very safe mineral to use. It helps to prevent cavities. The data out there is just, it's unbelievable. What we want to do though is, especially in pediatrics, is we have a child that's changing size, and with that the dosage changes. And so we want to make sure we're giving them the right amount, not too much and not too little. One of the common questions I get is, when do I start using a fluoridated toothpaste on my child? The average age is usually around 4, and the reason we pick 4 is because that's when a child can spit or expectorate when commanded. I mean, all kids can spit, as we know, but the problem is if you brush it, they start swallowing it. We advocate, even at a little earlier age, starting to use fluoridated toothpaste, but to use just the size of a green pea, no more. And if they swallow that, that's fine. The fluoride, the therapeutic index for fluoride is huge, meaning you would have to ingest so much to start getting any negative effects, unlike, say, morphine. If you take a little bit too much, bad things start happening. Fluoride has a huge margin of safety. And so we do encourage that they use a fluoridated toothpaste. For some kids, depending on the teeth, we may actually put them on a fluoride rinse, commercially available. We may put them on a toothpaste that we have to prescribe that has a lot of fluoride in it. And in really certain instances, sometimes we'll put them on systemic fluoride, which is actually a fluoride that they ingest. It's a pill or a liquid that they swallow. And we've also come out with some fluoride varnishes that have a lot of great qualities. We just paint it on the teeth and it stays there for a good 4 or 5 days. But there's so many different available fluorides out there that we taper it to just what your kid needs and just the dose they need. And as I've said earlier, the water here in San Angelo does have a significant amount of fluoride. Not too much, but at some stages we won't have to supplement with fluoride. But as kids get a little bit older, especially in the 6 to 16 year range, it's not enough for them. We need to optimize that and get them up to the level that works for them.